motto of the project is to prevent all NCDs. The project SOS, that is reduce salt, oil, and sugar, exercise daily, and lifestyle modifications to prevent other lifestyle diseases. So our theme is the theme is to ek chamach kam, char kadam aage. That is 1 spoon less of salt, sugar, and oil. We can go 4 steps forward to prevent all the NCDs. So today is World Heart Day. We are going to have a World Heart Day seminar. So the theme of the World Heart Day today is use heart to beat heart. That is to prevent or cardiovascular diseases, COVID, and other cardiac diseases. So we'll have an expert to talk on this. So first of all, I'll come to my present duty to welcome our chief guest, our DG, Rotarian Dr. Thomas Vavanikunnel, for being our chief guest of the day. And I especially welcome our zonal chairman, Rotarian PDG, Dr. Ajay Kumar. He is always instrumental in helping us, and always I welcome our district trainer, uh, PDG PG Muralidharan sir, and I also welcome, even though it's not there, our vice governor John Daniel, and chairman council of governors Rotarian PDG KPR, and the district council, the council of all governors, district officials, and district governor elect Rotarian K. Srinivasan, district governor nominee Rotarian Babumon, and welcome our secretary Rotarian Dr. George Mulel, IT officer Jojo, all assistant governors, presidents and secretaries of various clubs, and president all the club members from different clubs of our district 3211, and also our neighboring Rotary members and the district officials who have joined from the neighboring clubs. And I welcome the panel of the experts who have come for today's function. The panel, Dr. Prashant Sankar, he is the moderator of the today's function. He is the physician and diabetologist at Muthoot Hospital. He is Dr. Prashant Sankar, Muthoot Hospital, Pathanamthitta. Dr. Jyotidev Keshadev from Jyotidev Institute, Research Institute, Trivandrum. Dr. R. Ajay Kumar is a consultant cardiologist and interventional cardiologist at Cosmopolitan Hospital, Trivandrum. Dr. Rajesh Muralidharan is from Baby Memorial Hospital, Kozhikode, and Dr. S.R. Narasingan. He is the National Vice President of Lipid Association of India, and he is the adjunct professor of Dr. MGR University. And I welcome all the guests who have come, and all the Rotarians and the non-Rotarian friends who have come in large numbers to make our program a grand success. Thank you.
Thank you. Thank you, Harish. Thank you, Harish. District Trainer, Past District Governor PG Muralidharan, Zonal Coordinator of Preventive Health, Rotarian PDG Dr. Ajay Kumar, Vice Governor Rotarian Dr. John Daniel, Council of Governors Chairman Rotarian PDG KP Ramachandran Nair, Past District Governors, Governor-elect Rotarian K. Srinivasan, Governor nominee Rotarian K. Babumon, District Chief Officials, District Secretary General Dr. George F. Mulel, today's speakers, Dr. Prashant Sankar, who is the moderator of this seminar, and Dr. Jaydev Keshavan is a consultant diabetologist. Dr. Rajesh Muralidharan is a consultant cardiologist, and Rotarian Dr. R. Ajay Kumar. He's also a consultant cardiologist, and Dr. S.N. Narasingan. He's a physician and also a great physician and also a cardiologist. My dear trailblazer, assistant governors, district revenue district directors, district secretaries, district officials, president secretaries, and all the invited guests, and also past, present, and future leaders from neighboring districts. A warm welcome to you all. My dear friends, World Heart Day celebrated every year on 29th of September. Friends, cardiovascular disease is accountable for nearly half of all non-communicable disease deaths, making it the world's #1 killer. World Heart Day is therefore the perfect platform for the cardiovascular disease community to unite in the fight against cardiovascular disease and reduce the global disease burden. Created by the World Heart Federation, World Heart Day informs people around the globe that cardiovascular disease, including heart disease and stroke, is the world's leading cause of death, claiming 17.9 million lives each year, and highlights the actions that individuals can take to prevent and control cardiovascular disease. It aims to drive action to educate people that by controlling risk factors such as tobacco use, unhealthy diet, and physical inactivity, at least 80% of premature deaths from heart disease and stroke could be avoided. World Heart Day is a global campaign during which individuals, families, communities, and governments around the world participate in activities to take charge of their heart health and that of other people. Through the campaign, the World Heart Federation unites people from all countries and backgrounds in the fight against the cardiovascular disease burden and inspires and drives international action to encourage heart healthy living across the world. My dear friends, Rotary India's one of the important projects this year is Stop NCD, Stop Non-Communicable Disease, and Project Positive Health Preventive is one of the important projects of Rotary because, my dear friends, prevention is better than cure. That is the motto. And we Rotarians can contribute a lot to prevent this disease prevention. And disease prevention and treatment is Rotary's one of the areas of focus of Rotary International. And our RI director, Bharat Bandia, being a doctor, and he is very much promoting this positive project health. And my dear friends, we have eminent personalities here with us today to share their thoughts about this preventive health project. And I thank all Rotarians who are participating in this project. Thank you. And I also would like to congratulate Chairman Projective Positive Health, Dr. G. Harish Kumar. He's a leading diabetologist and physician, and is a member of my home club. Harish, thank you once again for organizing this seminar in a meticulous way. And also I would like to congratulate all the revenue district coordinators and advisor Johnny, Dr. Johnny Gabriel, and also the trailblazer assistant governors, presidents, secretaries, all the team 2021 for organizing this wonderful seminar. Thank you, one and all. Now it is over to Dr. Ajay, our zonal coordinator.
Good evening, everybody. Governor Dr. Thomas Vavanikunnel, District Trainer, past District Governor Muralidharan, DGE Srinivasan, DGN Babu Mohan, RRFC Dr. John Daniel, Galaxy of past District Governors, District General Secretary, my good friend Dr. George Mulail, District Chair, my relative Dr. Harish, all the district officials, President Secretaries of all the clubs in 3211, Rotarians, ANS, ANETs, guest speakers, and the invited guests of 3211. It gives me immense pleasure today to be once more on the Zoom meeting of your District 3211. Though I would have personally liked to visit each one of your clubs in your district and make acquaintances and friendship with each one of the Rotarians and their families in your district, this COVID menace has made me think otherwise. But I definitely have to appreciate the wonderful work your district, under the able and guiding force and the ever enthusiastic governor, Dr. Thomas Vavanikunnel, and his wonderful team is doing for the past 2 months. Starting from your induction of so many members in one evening, which I had an opportunity to be there. It has been a wonderful work which you are doing during this COVID times. Friends, this is the World Heart Day. And on this World Heart Day, I would request each one of the Rotarians and their families, including their parents, the grandparents, and all the relatives of the Rotarians, to know your numbers. Know your numbers is your height, your weight, your blood pressure, and your blood sugar values. So that if you find anything wrong, you could definitely correct it and thus prevent all the catastrophes which are associated with these non-communicable diseases. Today, we have gathered here on this World Heart Day, and let me take this opportunity to wish each one of you a very hale and healthy, as well as COVID-free time if you're in this decade which is there. Friends, our RI directors, Bharat and Kamal, have given us a wonderful project. It started as Project Positive Health and has been modified into prevention of non-communicable diseases. As Thomas told you, prevention is definitely better than cure. And just imagine what will happen if we, over the decades, prevent these non-communicable diseases and see that the generations to follow do not have or are less burdened with heart disease, cerebrovascular disease, diabetes mellitus, obesity, cervical cancer, and respiratory diseases. Just imagine what a terrible good thing it will be for our nation. And I'm sure this does not take place in one day, 1 year, 1 month, or 1 year, but over a few years, say about 8 to 10 years, I'm definite that this NCD project of Rotary India will definitely show the required signs and see that India is one of the healthier countries in the world. I'm not here to take much of time by making a big speech, because I know there are eminent cardiologists here who will be giving you enough data as well as enough advice on how to look after your heart as well as your health and prevent these non-communicable diseases. But I should once again congratulate your wonderful district with your district governor, Dr. Thomas, the wonderful team, as well as the district chair, Dr. Harish, who has done wonderful projects so far, and even this seminar the meticulous way it has been started, this goes to show the immense courage as well as gratitude he has got to see that these programs are coming very, very wonderfully done. Thank you once again, each and every one of 3211, and I look forward again to be with you whenever possible. Thank you very much. Thank you for inviting me for this program, Harish and Thomas. Thank you very much.
Thank you, Dr. Ajay, for sharing your thoughts on this World Heart Day. Now I invite our past district governor, district trainer, Rotarian PDG Murali sir, for his address.
Murali sir, you are not audible. It's something wrong with your microphone. No, Murali sir, it is not audible. You are not audible. Yeah, 1 second. Yes, sir.
Okay. Because my computer audio is not working, I will attend from my mobile phone.
Okay, we can hear you.
Beloved District Governor, Dr. Thomas Vavanikunnel, Health Preventive Zonal Coordinator, PDG Dr. Ajay Kumar, Vice Governor and RRFC, PDG Dr. John Daniel, Sivaji Chair, PDG KPR, past District Governors, DGE, DGN, District Chair, Dr. Harish Kumar, lineup of eminent speakers comprising Dr. Prashant Shankar, Dr. R. Ajay Kumar, Dr. Jyotidev Keshav, Dr. Rajesh Muralidharan, Dr. S.N. Narasimhan, District Secretary General Dr. George Moolel, district officials, assistant governors, president, secretaries, and fellow Rotarians. Good evening, everyone. Rotary International and Rotary Foundation adopted disease prevention and treatment as one of the 7 areas of focus. Disease prevention is considered more important than disease treatment as it requires a clear vision and long-term planning. 1 in 6 people worldwide cannot pay for healthcare. 100 million people are pushed into poverty each year by exorbitant medical costs. Rotary International encourages Rotary clubs and Rotarians who plan new service projects to partner with successful community-based healthcare organizations to strengthen and expand existing services and support health education programs that explain how diseases can be prevented. We also help immunize people against infectious diseases. As Rotary responds to the impact of the current global COVID-19 crisis, this has become one of the most important areas. Today, September 29, 2020 is observed as World Heart Day. It is a global campaign during which individuals, families, communities, and governments around the world participate in activities to take charge of their heart health and that of others. Cardiovascular diseases, CVD, is the focus of this year's theme observance, as CVD is the #1 cause of death on the planet. Stop NCD is one of the focus projects of our district this year. This consists of 4 important NCDs: 1, diabetes; 2, hypertension and heart diseases; 3, CV or stroke; and 4, chronic kidney diseases. Today's district seminar is titled Heart to Heart. We are indeed honored to have a lineup of expert speakers with us who will explain in simple terms what a person should know about heart conditions and how to prevent heart diseases. I take this opportunity to thank PDG Dr. Ajay Kumar from District 3201, who is our Rotary India Health Preventive Zonal Coordinator, for helping us organize this seminar. I also take this opportunity to thank the District Committee Chair, Rotarian Dr. Harish Kumar Ji, District Coordinator Dr. Johnny Gabriel, and Revenue District Coordinators for organizing this seminar and developing a set of goals under this focus area as a guidance for the clubs to do projects. I thank the presidents and secretaries for their keen interest in attending this seminar. Today's sessions will expand your knowledge about all aspects and help you become more effective. Thank you all and wish your clubs the very best for the year 2020-21. Thank you.
Thank you, PDG Murali sir, for your message. I recognize the presence of our Council of Governors Chairman, PDG KPR, and the Pastor Sri Governor Suresh Matthew, Pastor Sri Governor Skaria Jos Katur, Pastor Sri Governor E.K. Luke, and many of our Council of Governors are present. Thank you all for joining in this seminar. Over to our seminar moderator, Dr. Jaydesh
Prashant
Keshavdev.
Shankar. Prashant Shankar.
Prashant Shankar, or moderator Dr. Prashant Shankar, for his opening remarks.
Am I audible to all?
Yeah. Yes.
Yes, sir. Yes, sir. Yes, sir.
Thank you all. Thank you for inviting me for this wonderful evening on this very important day. I thank the Rotary for giving me this wonderful opportunity, and special thanks to Dr. Harish Kumar for inviting me to moderate this session. So my job is very simple. I want to introduce the importance of World Heart Day to each one of you, and to guide you and pave way for that for the other experts to explain on the individual aspects. So first of all, I would like to share some important information. Can I get the slide sharing for me?
One second, I am doing it, please. Yeah, it's okay, sir. It's okay, sir.
Yeah, thank you. Hope the slides are visible.
Yeah. Yeah.
So the theme of this year's World Heart Day is Use Heart to Beat Heart Disease. So what does it mean? So why we celebrate a World Heart Day? So the World Heart Day is being celebrated to inform people around the globe that cardiovascular disease, including heart disease and stroke, is the world's leading cause of death, and to highlight actions that individuals can take to prevent and control cardiovascular disease. And it's done to educate people on controlling the risk factors such as tobacco use, unhealthy diet, and physical inactivity. And also, we should know that at least 80% of premature deaths from heart disease and stroke could be avoided. So there is a big role for prevention of cardiovascular disease. Cardiovascular disease, as has been said previously, is the #1 cause of death in the planet. Many causes like smoking, diabetes, high blood pressure, obesity, air pollution, and there are also a set of neglected conditions like Chagas disease, amyloidosis, which are also there, which actually should not be neglected. COVID-19 has brought for CVD patients with a double-edged threat. What are they? They are more at risk of developing severe forms of the infection, and more importantly, they are afraid to seek ongoing care for their heart. So these are unprecedented times where the COVID-19 has actually shone a spotlight on the healthcare profession, and it has really tested the national healthcare system. And it has also made our individual responsibilities for our own health and for the vulnerable in this society. You should remember that people with a broken heart are more vulnerable to COVID-19, and also people with heart failure are also more vulnerable to COVID-19. We do not know what the course of the pandemic will take, what course the pandemic will take in the future, but what we do know is that taking care of our hearts is now more important than ever. Use your heart. Using heart is about using your head to understand what it takes to live a healthy heart life, and to act on that knowledge, changing your behavior for a better quality of life now and in the future. Using heart is about using your influence at individual level to set an example for your loved one. And as a healthcare professional like me, to help patients make positive changes for our heart health. And as an employer, to invest in the heart health of your employer. and as a government to implement policies and initiatives that will lead to better societal health of the heart. Using heart is about using your compassion to look beyond self and act in ways that support the most vulnerable in the society. And those use your compassion for those with underlying heart-related conditions that may put them at greater risk at the time of COVID-19. Use heart to stay healthy at home. Use your heart to get fit. Have a regular physical activity. Have a regular diet. Use heart to keep moving, keep physically active, whether you are inside the house or outside. This is how I looked like 5 years ago. Jyotidev sir might be remembering my picture, this picture 5 years ago, and this is how I look at this during this COVID time with good physical activity and healthy lifestyle. So it needs a lot of motivation to include a good physical activity and healthier diet in your lifestyle. Enjoy the time. Use your heart to dance till dawn. Keep entertaining yourself and keep entertaining others. Age is just a number. At any age, you can use your heart to keep healthy and active. You can engage in all types of activities. Very important, use your heart to say no to tobacco, because you have to use your heart to live smoke-free, whether it's the tobacco smoke or it's the pollution. Decreasing the smoke for at least this period of time will make you healthier. At least 72 hours will help you make your breathing easier and reduce the carbon monoxide, and at least 12 months of quitting smoking will reduce your risk of heart attack by 50%. Use your heart to improve access to health. There are many people who are denied of health care. And control the risk factors. Hypertension and diabetes are important causes of heart failure. Very important to screen for the diseases. And also use your heart to diagnose and treat early to prevent the dangerous complication. And if you are ill, use your heart to get back on your feet. Have your regular checkups. Don't miss your regular checkups. And use your heart to leave no disease neglected. There is nothing that as known as any unimportant disease. All diseases are important. Use your heart to live the best of your life and to fulfill your dreams. And use your heart for your loved ones. Spend enough time with your family members. Engage in your social life and reduce your stress. And use your heart to be always there for those in need of your help. Use it to make better choices, to save lives, to inspire every generation to be at your best, and for your society, your loved ones, and you. And use your heart to fight COVID using the preventive measures. And finally, use your heart to thank your heroes, especially the nurses and the frontline workers who have been trying hard to control the COVID infection. And finally, when you are in need of medical help, we are there to save your life. With that, I thank you all once again from the bottom of my heart for giving me this opportunity. Thank you all.
Thank you, Dr. Prashant, for that opening remarks. I recognize the presence of PDG Dr. G.A. George, who is the Health Curative Zonal Coordinator. Thank you, sir, for joining. Over to Prashant.
So I think I will now moderate the session. I will introduce the speakers and the topics which they are going to discuss. So the first speaker is going to be Dr. Ajay Kumar. I will just give an introduction of Dr. Ajay Kumar. He is the son of Mr. R. Ramachandran Nair, who is the former Chief Secretary to the Government of Kerala. He is currently working as a Senior Consultant Intervention Cardiologist at Cosmopolitan Hospital, Trivandrum, and also as an Intervention Cardiologist at SSN Medical Mission Hospital, Vakala, Trivandrum. He is also a visiting consultant at Re Medical Center, Sharjah. He is also a certified fellow of AFAC, a certified fellow of American College of Cardiology, and international fellow of the European Society of Cardiology. And he also has a fellowship in intervention cardiology done at the Narayana Hrudayalaya Institute. He has 15 years of continuous work in the field of invasive cardiology from 2005, totaling more than 8,000 cardiac catheterization procedures. He's also involved in cardiology teaching. He's an author of several papers in cardiology at national and international journals. And he has taken lectures and given topics in cardiology at many international and international forums, and participated and organized various cardiology conferences and seminars inside and outside India. So he is also an on-stage performer of Kathakali, not away from the medical field, and he is a prize winner in Kathakali for 4 consecutive years at the annual youth festivals and University of Kerala. And he is also a versatile Carnatic music singer, and he has participated in different forums after getting trained under the famous teacher and musician Professor Mavelikara Prabha And with this, I introduce Dr. Ajay Kumar to carry on with his message and the next topic, which will be how to recognize a heart attack. Over to you, sir.
Good evening, everyone. All Rotarians, I am also a Rotarian. I am from the Seacoast Club in Trivandrum. I am a young Rotarian, so to say. I am only a Rotarian for the last 2 years. So we have a lot of past district governors among us. So I am a small boy in Rotary Club, but I have been introduced as a senior person. I'm not that senior. So let me go to my talk. I think my screen is seen now. Can you see my slide?
Yes.
Yes, sir. It's visible.
So let me start by saying that this World Heart Day, the message is very clear. It has been very clearly initiated now. Use heart to beat heart disease. And now the topic given to me is how to recognize a heart attack. So that is a very important talk. First of all, let me say 29th of September is World Heart Day. 2020, as it is said, is in between the great pandemic of COVID-19. We are talking about heart disease. The importance of heart disease in COVID-19 is also very clear. Cardiac disease patients are dying more compared to other patients who are not having diseases or having other diseases. So many of the great people in our country, like a great singer who died recently, he also had cardiovascular disease. So people who are having cardiovascular disease have to be given particular care. So when we say use heart to beat CVD, it means both COVID-19 as well as cardiovascular disease. Why cardiovascular disease is important, that's also we have discussed now. Cardiovascular disease is the #1 killer. Earlier it was said that among the non-communicable diseases, 50% of the people die with cardiovascular disease. Even if you take the whole mortality of humankind, almost 30% of humankind dies of cardiovascular disease. So if you take 3 people among us, one of us are going to die with cardiovascular disease in this generation. So at least next generation, we have to come out of this. Cardiovascular disease mortality have to be brought down. For that, the message by World Heart Federation this World Heart Day is use heart to beat CVD, both COVID-19 as well as cardiovascular disease. So as said earlier, use heart for society, for your loved ones and you. Cardiovascular disease is the #1 cause of death on the planet. It has many causes like smoking, diabetes, high blood pressure, obesity, air pollution, and many rare and neglected conditions. In the time of COVID-19, CVD patients are faced with a double-edged threat. They are more at risk of developing severe forms of COVID-19, as well as they may also be afraid to seek ongoing care for their hearts, because as you know, many of the cardiovascular disease patients are so afraid to go out of their houses. So they remain inside the houses, and even if they get a symptom of heart disease like chest pain or breathing difficulty or giddiness or syncope, they are afraid to go out. So it is the duty of every one of us to identify the cardiovascular disease patients amongst us and give them support in this time of COVID-19, especially now in my city, that is Trivandrum. The numbers have grown much more. It is the government says that it is 1,000 per day, but I see lots and lots more because my own hospital is filled with COVID-19 patients. So I think the numbers are much more than the numbers which is being said by the government. So cardiovascular disease patients have to be given special privilege. You have to identify cardiovascular disease patients in your house, in your neighborhood, your friend circle, even in our Rotary club, we have to identify our cardiovascular disease patients and give them full support. So what is use heart? What is the meaning? Your mind, emotion and energy has to be, you have to focus it for the heart healthy life as well as changing your behavior. Your influence has to be used as an individual, as a healthcare professional, as an employer, as a government, for concentrating on the work for preventing heart disease. And your compassion for looking beyond the self and act in ways that support the most vulnerable in the society during this COVID-19. So this is one slide which is put forward by the World Heart Federation. You can see that in the website of World Heart Federation. I suggest every one of you to at least once today or tomorrow go to the site of World Heart Federation and see. And you can yourself create posters and download it as PDF files or JPEG files. And you can circulate among your family members. And you can put your own group photos where you can put a novel use of the statement, use heart to beat heart disease. Like that you can add whatever you want and you can put your pictures where you do group activities. These things can be put. Why we focus in that is because only if you involve everybody, then only we can prevent cardiovascular disease. Because as doctors, we see that every day. Now we see people with the age of 25 years coming to us with heart attack. So we are at a loss when we think that what we can do to prevent, because we are always working in the side of treatment always. As a cardiologist, we are focused more on treatment. But to the society, the treatment aspect is important, but much more important is prevention. So earlier it was said prevention is better than cure, but it is more important in cardiovascular disease. If you compare it with other diseases, prevention is much more important in cardiovascular disease than in any other diseases, because prevention is eminently possible in cardiovascular disease. So in heart diseases, if you see, the preventive measures are much more effective compared to other diseases. Like cancer, you may think that it is preventable. Many times we don't know. People get cancer without much of risk factors. But cardiovascular disease, if you see, almost everyone who come to us with heart disease, we can find out one or the other risk factor. So I suggest every one of you to go to the site and download with your own photos. You can make your own posters. It's very easy. In 3 or 4 steps, you can make the poster and circulate it in your WhatsApp groups as well as in Facebook. So now coming to my topic of heart attack, how to recognize a heart attack. So when you talk about heart attack, we have to talk about the heart as the organ. So what is the function of heart as an organ? It has only one function. It receives blood and it pumps out blood. So it receives blood from the veins and pumps out the blood into the arteries. So what happens to the blood when it passes through the heart? It becomes a high potential energy blood, meaning the blood pressure inside the veins are very low, but heart converts low pressure venous blood into a high pressure arterial blood. Why high pressure is needed? Because this high pressure drives the circulation and brings blood to each and every cell of your body. A human being has something like 3 or 4 billion cells. So every one of these 3 or 4 billion cells is being supplied by blood by the heart every second of your life. To focus it more for you or make it more easy for you to understand, I can tell you, if the heart or the cardiovascular system stops for even 3 seconds, the brain will stop functioning. It does not mean brain get damaged, but it stops functioning. How you will know about it? You will collapse. People who collapse having a vasovagal syncope or whatever, there what is happening is the heart stops for 2.5 to 3 seconds. So if you have not over a period of 50 or 60 or 70 years of your life, you have not had a syncope or a collapse or a sudden loss of consciousness, that means that your heart has not stopped even 3 seconds in this long period of your life. So that is the amount of work being done by your heart. So why does the heart do that? To make sure that every second of your life, every single cell among your 3 or 4 billion cells in your body is supplied by blood. What is there in the blood? It is glucose, nutrients, oxygen, and it removes all the excretionary things like creatine, urea, as well as carbon dioxide from the cells, and it removes it from the system. So basically, heart does a great work. But what are you doing back to it? That is the question. When your life is being supported all through your life, when you say through your life, it starts from 5th week of gestation. That means 5th week of intrauterine life, your heart starts beating. And when does it stop? At the moment of your death. So throughout all these years, it does not even stop or take rest for 3 seconds. But what are you doing for it? Are you supporting it? Are you even thinking about it? You are neglecting it in every way it is possible. So you have to focus the attention of everybody to it. So what is the most dangerous disease of the heart? It is heart attack. So what is heart attack? It is basically the blood vessels which are stationed in above the outside the heart. You can see here these blood vessels, which are called coronary arteries, they take blood to the muscles of the heart. Even though heart is filled with blood, that blood does not supply oxygen or nutrients to the muscles of the heart. For supplying nutrients and oxygen to the muscles of the heart, there are separate arteries, which are small arteries, which are called coronary arteries. So the coronary artery disease is the cause of heart attack. So what happens? There is increased deposition and disease process which occurs in the wall of the coronary artery, which forms a block, which initially only squeezes the blood a little bit. Later on, it becomes very severe. And at the point of heart attack, what happens is blood clots inside these stenosed parts of the coronary artery and occludes the vessel, thereby producing a heart attack, wherein the heart muscles in that area supplied by that artery does not get blood, thereby no oxygen. When the heart is continuously pumping and it is working, it is getting devoid of oxygen supply. So this is a major cause of death in human race. That is heart attack. Everyone knows that what about heart attack. You always see in your neighborhood one person dies and you say, okay, he has had a heart attack and he died. So, but what is it? It is basically a disease process in the arterial wall of coronary arteries which supply blood to the heart. So, if you say there are 3 things being talked about all the time. One is heart attack, second is cardiac arrest, third is heart failure. So many people are confused among these 3 things. What is heart attack, what is cardiac arrest, and what is heart failure? People confuse with each other. Heart attack, as I told you, is a circulatory problem wherein blood supply to the muscles of the heart is reduced or stopped. That is heart attack. So what is cardiac arrest? It is an electrical problem of the heart wherein the heart stops contracting or goes into fibrillation, wherein effective contraction of the heart stops and thereby the person dies. So heart attacks many times produces cardiac arrest, but it is not equivalent to cardiac arrest. Cardiac arrest is another condition. Then comes another condition that is called the heart failure. So what is the difference from heart failure, from heart attack and cardiac arrest? Heart attack is a circulatory problem, cardiac arrest is an electrical problem, and heart failure is a functional problem of the heart, wherein the heart is expected to pump a certain amount of blood in over a period of a time, or in 1 minute amount of this much liters of blood has to be pumped. That is called the cardiac output. When that amount is reduced, or the performance of the heart reduces, so there is a functional problem which is called heart failure. Even though all these things can cause each other, like heart attack can cause heart failure can produce cardiac arrest, heart attack can produce cardiac arrest, but these are three different things. Everyone should understand the difference between heart attack, cardiac arrest, and heart failure. Today the topic is heart attack. Let me come to that. So what are the commonest symptoms of heart attack? So first is pain and discomfort in the chest. Second is lightheadedness, nausea or vomiting. Third is jaw, neck or back pain. Fourth is discomfort or pain in arm or shoulder. And fifth one is shortness of breath. So there are little bit differences between the symptoms seen in men and women. I'm not going much into that, but there are little differences. Now, what is the commonest symptom? That is the angina pectoris. Everyone has heard of it, but many of us don't know what it actually means. So the commonest symptom of heart attack is angina pectoris. Angina pectoris occurs when the heart muscles does not receive an adequate amount of blood or oxygen needed for a given level of work. Most common angina symptoms are a pressing, squeezing or crushing pain, usually in the chest under the breastbone, but may also occur in the upper back, both arms, necks or earlobes. Pain radiating in the arms, shoulders, jaw, neck or back. And sometimes angina may not present with pain, it may present as a shortness of breath. Many of you know that silent heart attack in chronic diabetes, who are uncontrolled diabetes, where the nerves are all affected, they may not feel the pain, but they may feel other symptoms of the heart attack like shortness of breath, severe fatigue or weakness, sweating, and a generalized discomfort in the chest, not a typical pain. So angina usually begins with physical exertion. Other triggers of angina are emotional stress, extreme cold and heat, heavy meals, excessive alcohol consumption, and cigarette smoking. So angina is usually relieved by taking rest or by taking nitroglycerin. But many times when you have a severe heart attack, even if you take rest or take nitroglycerin, the pain will continue, and the pain of heart attack is one of the most severe pain human beings ever suffer. So you can see this slide where you can see usually a heart attack patient will show a hand, the right hand on the left chest like this, like a squeezing pain. And many times the pain may not be just in the chest, it may be going towards the neck. It can be in the chest as well as in the shoulders, or sometimes from the chest it may go downwards to the abdomen, upper abdomen, or it may go into both the hands, or it can just be a squeezing pain in the neck, which is called a choking sensation, which is a typical angina where there is no chest pain but only a choking sensation in the neck, or a pain in the shoulder alone with the pain radiating through both the hands, or just a pain in the back. So these are the different ways in which the pain of angina can present. So what are the types of angina? One is effort angina, angina which occurs on effort but goes away with rest. Second is rest angina, which occurs even at rest, which is usually the sign of a heart attack. Then chronic stable angina is years, pain is there only on walking a certain distance, but when you take rest, it goes. Second, another one is nocturnal angina, which occurs only in night. Usually the cause is sudden increase in heart rate during sleep when you change from a from non-rapid eye movement sleep to another pattern, which is a rapid eye movement sleep, where the heart rate increases and you get angina. Then rapidly progressive angina, variant angina, which is usually seen in females, where there is no blockage actually in the vessel, but it is a spasm of the coronary vessel. And postprandial angina is a very typical angina where you take food, suddenly you get angina. Once the food is digested, the pain goes. Why? Because when you are eating sufficient quantity of food and the intestine is trying to digest, what happens is blood from other system is diverted for the digestion process. So already when there is a less blood supply to the heart muscle, that will suddenly decrease when you take food. So postprandial angina is a very typical form of angina. Then the silent angina, as I told you, in diabetic patients, and there is another angina which is called microvascular angina, which is caused by small vessel disease rather than a coronary artery disease. So, as I told you, there are different types of symptoms in females, and unexpected signs of heart attack in women are like tightness in your jaw, abdominal pain, extreme upper back pain or pressure, extreme fatigue, nausea, dizziness, and sweating, a squeezing feeling in the chest, prolonged symptoms. These are all symptoms in females. Now, what are the important things? 11 heart attack symptoms that you should never ignore. Chest pain, tightness, or pressure lasting for several minutes. Nausea, indigestion, heartburn, stomach pain, or vomiting. Breaking out in cold sweat for no obvious reason. Sudden dizziness or lightheadedness. Pain radiating down the left side of your body, starts from chest, moves outwards. Jaw or throat pain, often radiating up from the chest. Sudden fatigue and shortness of breath from activities you can usually tolerate. Sudden development of loud snoring, choking, or gasping while asleep. A persistent cough with white or pinkish mucus. Swollen ankles, lower legs, and feet. Heart palpitations or irregular heartbeats. So, certain other conditions also can mimic angina. They are anxiety attacks or panic attacks. Aortic dissection, which is a very dangerous condition, which is not actually a heart attack, but it is more dangerous than heart attack. Then a simple thing like gastroesophageal reflux disease also can produce a esophageal spasm. The food pipe gets spasm, which produces a typical form of angina like symptom, but it is not a heart disease. Then myocarditis is the inflammation of the heart muscle. Pericarditis is the inflammation of the covering of the heart, as well as pneumonia also can produce angina symptom. Now coming to diagnosing angina pectoris, as you all know, the usual test which we use are electrocardiogram, ECG, which is the commonest bedside tool by which you can immediately diagnose a heart attack. Then once you have an ECG change, immediately a blood has to be checked for troponin T or I, or another enzyme which is called CPKNB. Then another test which is usually done not in heart attacks, but in chronic stable angina situation, where you do a treadmill test to evoke a response of the myocardium for ischemia or to produce changes in the ECG. If the ECG does not have any change at rest, you make the patient to do exercise and induce ischemia and produce the sign. Then echocardiogram is a simple ultrasound scanning technique by which you can visualize the heart muscle and the valves and functioning of the heart. Thereby, you can get an idea about the function of the heart. And the gold standard test in angina or coronary disease or heart attack is coronary angiogram. Nowadays, almost all the good centers have cath lab facility wherein we do angiography at the time of heart attack. So within 1 hour of reaching the hospital, we will take the patient to a cath lab and do the angiogram and find out the problem where the blood clotted and produced the obstruction. We will relieve it by doing an angioplasty. So I am not going into the treatment aspect. That will be dealt by another person. So what are the things you should know? Rush to the doctor or the hospital if the pain is accompanied by a chest tightness, squeezing, heaviness, weakness, nausea, shortness of breath, sweating, dizziness, sense of impending doom. Many patients say When you have a heart attack, they feel that they are going to die. So that is the feeling they get. And radiation of the pain to the shoulder, arms and jaw, this is a typical sign of angina. And the angina worsening in the first 10 to 15 minutes, immediately the patient should be taken to a hospital for the further treatment. So how to survive a heart attack when you are alone? Most important thing is when you have a severe chest pain, and you should not ignore it first and foremost. If you have a chest pain and any pain anywhere in the chest, definitely take it seriously. 1, 2. The very first thing to do is to call for emergency medical help. Don't try to treat yourself. If you have a chest pain, always inform the person who is near to you. Maybe an unknown person also, but immediately tell that person. Third one is aspirin or immediate medication. If that is available, you can take, or you have to immediately rush to the casualty. So common drugs are, as you all know, is statins, beta blockers, blood thinners like aspirin, clopidogrel, ticagrelor. These are the drugs. And lifestyle changes comes later. Once you treat the immediate heart attack, then comes to the lifestyle changes, which is called secondary prevention. Now, in the today's World Heart Day, these are the things which are said. How you change the lifestyle: use hard to eat well and drink wisely. Use hard to get more active. Use hard to say no to tobacco, and use hard to stay active. Use hard to get outdoors. Use hard to cycle. Like that, I suggest every one of you to visit the World Heart Federation website and create your own posters and circulate to everyone. Thank you very much.
Thank you. Thank you, Dr. Rotarian, Dr. Ajay Kumar, for that very useful and informative session on heart attack. Over to moderator. I recognize the presence of PDG R. Raghunath. Over to thank you, Raghu, for joining. Our moderator is Jojo. Please unmute him. Okay.
Yeah. Thank you, Dr. Ajay Kumar, for that wonderful, enlightening lecture on the basics of heart attack, how to detect a heart attack, and how to prevent the complications. So I move on to the next speaker of the day. It's none other than my dearest Dr. Jyotidev sir, and he is known to all of you or most of you. And he is one person I am greatly indebted to in my clinical practice, who has guided me a lot in taking up diabetology as an area of practice. Jyotidev sir, as you know, is an alumni of Preventive Medical College, and he is from Mayo Clinic, USA. He is a very much sought after speaker at the national and international level. He has presented research and delivered lectures at almost all the international diabetes meetings like the American Diabetes Association, the International Diabetes Federation, the EASD, the technology meeting like the ATTD. And he's a pioneer in telemedicine. He is the earliest in the country to start telemedicine as a cost-effective solution. And now we know how important it has become during the COVID time. He has also undergone training in geriatry in New York. Is widely popular among the international academic fraternity for original publications in telemedicine, insulin pumps, continuous glucose monitoring, and all the latest technologies in diabetes. He has got numerous original publications to his credit, probably the largest number of publications from the state, and other chapters in many textbooks, and lectured in over more than 1,000 forums in more than 20 countries. And he is a reviewer of more than a dozen of endocrine journals, including Diabetes Care of the American Diabetes Association. And he spends a huge amount of time in research and education, which has helped physicians like us a lot in our practice. He is also the chairman of P. Keshavadeva Trust, Diet Screen Kerala, extensively involved in education of doctors, public and patients via newsletters and organizing diabetes CME programs. He has already completed more than 580 free camps across Kerala. He is also worked as an assistant professor in Medical College Trivandrum. He is also the vice president of the Obesity Prevention Association, the AIAARO Kerala chapter. Jyotidev's Diabetic Center is an IDF, International Diabetic Federation recognized center of excellence in diabetes care and education. And he is presently the chairman and managing director of Jyotidev Diabetes and Research Center, Trivandrum, Kochi, and Attingal. And I hand over the session to you, dear Jyotidev, for your enlightening thoughts and lecture.
So hope I am audible.
Yes, sir.
Yes.
So thank
Yes,
you.
sir.
First of all, thank you very much. Thank you very much, my dear Rotary Club, for this opportunity. And thanks to Dr. Harish for inviting me on this very auspicious day. And thank you very much, Prasant, for the beautiful and the sincere introductory remarks. So I am deeply indebted to Rotary. And this is a very nostalgic picture. And some of you might know this. I was part of the Rotary Group Study Exchange program, and that was 20 years ago. And this was a picture taken in the May of 2000. And this journey, that was first time in the US, it has totally changed my attitude, my life as a doctor, as a researcher, and as a human being. So this picture I used to show whenever I do lectures for the Rotary. And to my topic, and this is a continuation to what Dr. Ajay Kumar has spoken. And this is about the common soil hypothesis. So whenever we speak about diabetes and heart disease, actually they have a common origin. And that is why we call it as a common soil hypothesis. And it seems that they are helping each other. So there is a bidirectional association between the so-called insulin resistance, which is the basic pathophysiological defect in type 2 diabetes, and the occurrence of coronary artery disease, and that is via all these toxicities, the toxicity which is induced by glucose, by the lipids, and these are the inflammatory markers which are listed over there. And for the common man, and for me and you, the understanding is that this is a continuum. In diabetes, even a decade before the actual diagnosis of diabetes, the insulin resistance and the propensity for the vascular damage resulting in cardiovascular disease starts. And if you look at the numbers, these are stunning numbers. We have 76 million, close to 80 million subjects with diabetes in India, and half of them are undiagnosed. And if you look at the global statistics, heart disease is the cause of death in more than 2/3 of those subjects with diabetes, especially above the age of 65 years. And precious years are lost, both for men and women. And actually, women over the age of 50 years, they are at a higher risk. And the number of years lost are more for women compared to men. And this is our good friend, Dr. Anu Mishra. And he has described the normal BMI and the abnormal BMI for the Asian Indian population. And for decades, it has been recognized by the World Health Organization. So even though we look lean, we look not as overweight or obese. Actually, we are obese. For a Caucasian population, obesity is defined when the body mass index is more than 30. But for us, with abdominal obesity and with less of muscle mass, the definition of overweight is when it is 23 or above, and obesity is when it is 25 or above, predisposing to the not only the components of metabolic syndrome, but also coronary artery disease and type 2 diabetes. And these two are interrelated and interconnected. And this is an experience which we shared. Dr. Prashant has also commented in the Facebook. So this was an experience. I had two similar experiences during this lockdown. When a patient, this was a new patient who communicated through the a phone and then through the WhatsApp, and he complained of a chest discomfort. I told him, you are having an Apple Watch, sir, why don't you take an ECG and get that ECG over the WhatsApp or via the email. So, you know, the Apple Watches for the last 2 years, they have a option for ECG. Of course, this is not meant for diagnosing a heart attack, but during the pandemic, when I recognized that there is an ST depression, which signifies the occurrence of a heart disease. Of course, it was normal ECG in between. I referred him immediately, and there were 3 blocks, and the life was saved. So the message here is very simple. Most of us will be owning these technologies. We'll be having a fairly good watch or a wearable device or a phone. But remember, those new wearable technologies and the smartphones are not just for the use of a WhatsApp or internet or telephone, but they are in fact, healthcare devices with advanced and accurate technologies. And over to the millions developing complications in diabetes. And this is an Indian scenario, as published by Dr. Mohan from Chennai, on the numbers of patients developing the vascular complications of diabetes. Diabetes as a disease which is unrecognized and not treated properly because patients have an inertia. They don't accept the treatment when it is advised, since it is an asymptomatic disease. Because most of the patients with diabetes, during the initial 8 to 10 years, they do not have any symptoms. But eventually, look at the numbers developing heart disease, amputations, blindness, kidney disease. So diabetes is the major contributor to all these complications in India. And this is why the international and the national agencies are recommending treatment of diabetes based on the development of complications or the propensity or the risk of development of complications. So we have the 5 choices of treatment here. Earlier, it was not there. Now for doctors, there is an algorithm by which we need to pick up the treatment. So this is personalized. So this is a specific customized treatment for the individual. Those who are having a heart disease, or those who are having a chance of developing a heart disease or a kidney disease, or my objective treating diabetes is to reduce the body weight, or a patient is there where there is more chance of developing a low sugar and even complications due to low sugar. So depending on those parameters, I can choose a therapy. Last but not the least, there is an area over there where cost is the major issue, because the chunk of the population, they cannot afford anything. It is out-of-pocket expenses in India. And for the poor with diabetes, we have the recommended therapies where probably we may have to go for the older drugs. So these are some examples of therapies such as empagliflozin, which has been in clinical trials, shown that this is one of those therapies, along with many other therapies, which can prevent heart disease, heart attack, heart failure, which is well described by Dr. Ajay Kumar, and even reduces the death in diabetes. So this has been approved globally. Some of these therapies to be given in diabetes to reduce the cardiovascular or heart disease death and all-cause mortality. And some of these injections where even it acts on the blood vessel wall, such as liraglutide, and that is Victoza. Not new, of course, I am not discussing anything new. It is available in Kerala in India for more than 11 years now. And these are therapies fairly, the cost is fairly high, but the evidence, these are some of the publications from our own center on the multiple benefits and its safety and efficacy using it in the Indian population. And the same therapy is also available in combination with insulin and with the complementary benefits. So when you combine 2 drugs, which are the best therapies with different mechanisms of action, which can reduce the blood sugar, which can reduce the hypoglycemia, which can reduce the body weight, which can reduce the blood pressure, which can improve the cardiovascular health. These are the real complementary therapies. And this is also available in India, and this is the examples of GLP-1, the injectable therapies similar to insulin, but with multiple other benefits. And this is injectable therapy. And the same GLP-1, it is approved in India now. Ribelsus is the oral therapy which is replacing or which will be existing as a cardiovascular safe and a superior therapy in diabetes. So this is for the first time after 100 years of discovery of insulin, an injectable therapy is going to be available as an oral therapy. And this is semaglutide, and this probably is having the same benefits as a liraglutide, which can be taken as a oral therapy daily. And this will be discussed in detail by the subsequent speakers. We need to assess the cardiovascular risk, and several risk calculators are available to calculate the 10-year risk probability of developing a heart attack that we can assess depending upon the several parameters, whether you are having diabetes or whether you are a smoker, whether there is a family history of heart disease. And this is a QRS3 calculator, and I like this calculator because in this calculator, as you can see here, you can even select the ethnicity as a choice. So India is there as a choice because we are having a higher propensity for the development of heart disease. And this is a 48-year-old individual, and I have put in all those parameters. He's a light smoker, he's having diabetes, he's having early stages of chronic kidney disease, he's having erectile dysfunction, he doesn't have rheumatoid arthritis. And when I calculated the risk, it is 37.6. And as you can see over there at the bottom, so I will play the video over there, and you can see that his age, that is the age of the heart, though he is only 48 years, it is 80 years. The QRS3 heart health age, healthy heart age is 80 years. And that makes sense. We nowadays go by not the chronological age of the individual. You may be 60 years old, but if your heart is healthy, if your organs are healthy, we will calculate, and your biological or the functional age could be even less by more than 10 or 15 years. And the reverse can also happen. So we have been using a telemanagement or a telemedicine system, and this we started in the year 1997. So this is meant for frequent dose titrations. Since in diabetes, in-person visits may not be suitable for dose titrations. Very frequent dose modifications may be necessary. And also to ensure that drug adherence, because drug adherence is diabetes is very, very important. Otherwise, the patients will stop a therapy such as for lowering the cholesterol. And we have a lot of publications on the benefits of diabetes telemanagement system. And this is one on a follow-up for more than 15 years. And with an evidence on reducing the vascular complications in subjects in India, including coronary artery disease, with very close personalized management protocols and patients being followed up virtually in addition to in-person direct visits to the hospital twice or thrice a month. But the virtual consultations were much more in number. So Dr. Harish, my dear friend from Pala, he has asked me that I should be including some of the technologies in diabetes as well. Of course, many of these are not new, but some of them are really useful, extremely beneficial during this pandemic, when we are ourselves scared to visit the hospitals. Because when we visit the hospital and stay there for more than 10 minutes, there is a higher chance for exposure to the virus and to the infections. So these are sensors for monitoring the glucose values, and this is available in Kerala. We started using this in the year 2004. But now, because of the advancement in technologies, these are becoming very accurate. This is available in your phone, and somebody who is a doctor or a nurse or an educator or your relative can have a remote monitoring capability, and they can be even a continent away, and everything is in real time in live. And the beauty of these technologies are, the blood sugar need to be controlled within a range. So when the blood sugars are going up or when there's a low trend, it will provide you with an alert 30 minutes or 45 minutes based on your programming. So you can prevent a hypo and you can also prevent a hyperglycemia. The same is available in your watch as an SMS, and 2 arrows pointing or 1 arrow pointing, everything has got a particular number in this. And in 2020 onwards, this year onwards, the American Diabetes Association, the ATTD, there is a consensus on providing an ambulatory glucose profile report to the patients. And this is in very simple terms, complementing the age-old glycated hemoglobin and A1C, which all of you are aware of. So the A1C is meant only for blood sugar, but here there is a target which is normal between 70 and 180, and this is called time in target. And there is a level 1 hyperglycemia above 180, level 2 above 250, level 1 hypo below 70, and level 2 below 54. The objective is to ensure less time spent in hypoglycemia. There is a particular percentage for every individual, and this is again customized based on the age and the type of diabetes. In general, between 70 and 180 should be more than 70 or 80% of the time. And these are some of the devices which can provide you with time in range, and Freestyle Libre Pro available in India for more than 5 years for 14 days of blood sugar monitoring. You just attach it and forget it. I am pretty sure that most of you are aware of this particular device, very cost effective, extremely cheap for 14 days of monitoring, again providing you with an automated report on these red colors are the hypoglycemic levels. And during the daytime, the blood sugars are either normal or high. But during the night, when the patient is sleeping, you can see there is red colored areas over there, and that is hypoglycemia, where immediately we need to make changes in the therapy so that we can prevent a death during the night time. Very common to develop complications, and these newer technologies are mainly intended for preventing the complications. And for those who are less affordable, the connected glucose meters connecting via Bluetooth to an ordinary smartphone, providing you with time above range, time below range. And after your blood glucose monitoring, you can send the diary as a PDF report where it is again color coded. Extremely important during this COVID pandemic. The patients need not visit the hospital. They can either send this in real time or they can send it as a PDF diary. And insulin pumps again been in the market for a lot of time. Since 2005 we have been using it, and for the last 5 years it is also automated, preventing hypo. And we will be witnessing the launch of tiny insulin pumps very soon in India, and this doesn't have any tubes or strings attached, and this is a solo micro pump. Aspirin therapy vividly described, and also the importance of statins. The cholesterol lowering medications, even in one of our research published and present in Europe, we said we need to spend less than 5 rupees per day for patients with diabetes to prevent a heart disease. Of course, along with exercise, diet, and other medications. So in conclusion, a decade ago, the management of diabetes was only to reduce the sugars, and the focus was only on conventional investigations and minimal therapies. But now, the management of diabetes is apart from glucose lowering, preventing heart disease and kidney disease, and providing an ambulatory glucose profile and a TAR report, and using multiple therapies, and encouraging the use of home blood pressure and home blood glucose monitoring. So this is a monthly diabetes newsletter which we are publishing for the last 12 years. And this is available free in the internet at this URL. So thank you so much, dear Rotary Club, for this opportunity. And thank you, dear friends. Unmute, sir.
Can you hear me?
Yes, yes.
Oh, okay. Thank you, Jaydev. Now over to moderator.
Thank you, Jyoti sir, for that wonderful, enlightening lecture. It didn't seem like a lecture for the Rotarians. It looked like a medical lecture. It was so much filled with information. And as rightly said, you have enlightened us about the latest in the technology. I think sir has requested that he wanted to leave early because he wanted to attend another program. There are a couple of questions which are there. We will take up those questions and then move to the next topic. The first question is by Mr. Kumaraswamy Pillai. If I remember correctly, Mr. Kumaraswamy Pillai is the father of my own batchmate, Mr. Krishna Kumar. Nice to see you, sir, here after a long time. My schoolmate, Krishna Kumar. So the question is to Joseph, sir, is it is said that the diabetic people will in general survive only for 25 to 30 years. Is it true? Is there any way to extend the life of a diabetic patient? What are the safe levels of glucose for senior citizens at fasting and postprandial sugars with allowance given for their age? Two very important questions.
Yeah, very interesting and important question. So the answer is diabetes patients can live very similar to a subject without diabetes. I am now 53 years old and my mother became a diabetic soon after I was born. And she is still alive and she still writes novels and stories. So that is one of the examples, living examples. And we do have many patients who have completed more than 45 years with diabetes. Everything depends upon how you treat diabetes during the initial years. And number two, the initiation of some of the drugs such as insulin should never be delayed. If there is a necessity for starting insulin, it should be started before the glucoses are very high. Because even though we have discussed about so many new therapies which can prevent the heart disease and kidney disease, insulin as a therapy which has completed almost 99 years is time-tested and most robust therapy for diabetes. And this is usually started late because insulin, when it is given, the blood sugars need to be monitored. And your next question, Kumaraswamy Pillai sir, that is on the level of senior citizens. I told you that the blood sugar levels, the blood pressure levels, it's all dependent on the functional age of the person. It is not dependent on the chronological age. So if somebody is at the age of 65 or 70 keeping very healthy with diabetes, then we calculate in terms of remaining years of life expectancy. If the remaining years of life expectancy as calculated is more than 8 years, we try to be more stringent. But as a rough calculation or a rough recommendation, I believe that Prashant Shankar will also agree with me. For persons above the age of 70 or 75 years, we will try to prevent hypoglycemia if they are not using any technologies. In that case, we will try to keep the fasting around 110 to 120 and the 2 hour after meal and at dinner time below 170. But if there is a more chance of developing hypoglycemia, I don't even mind going up to 180. But with more complications, we will be less stringent. But if there are less complications and more likely to live longer, we will try to be very strict in managing diabetes. So thank you.
Thank you, doctor, very much for your.
Thank you, sir. That was a very crisp answer.
Thank you, Prashant. Also, thank you very much. Nice to see you on the video screen.
Yeah.
After a long time.
Yeah. Thank you, sir. There is another question to you, Jyotisha, sir. Please let us know any scientifically proven advantage of yoga in diabetes and also the prevention of cardiovascular disease.
Definitely, even in the textbooks it is there. Even in the textbooks it is there in the use of yoga. And we are all part of RSSDA. Prashant and I, RSSDA is the largest scientific organization for diabetes in India. And there is an RSSDA driven study, and our center is also part of that program, where we are testing the benefits of yoga, if any, in pre-diabetes progression to diabetes. So definitely yoga as a relaxation and as an exercise do have a role. But if you look at the overall recommendations, it will be 150 minutes of minimum exercise aerobic activity per week. So as a general recommendation, I would say that 30 minutes of physical activity every day. So even if you are doing yoga, yoga is of course good, but physical activity in the form of an exercise is also recommended by the American Diabetes and the American Heart Associations. Thank you.
One last question to you, sir. Do we have any new technologies for checking blood sugar by sweat, tears, or saliva?
Yeah, that is a very exciting question by Dr. Harish. Google is doing some clinical trials along with Dexcom. You know, the Dexcom is one of the world leaders in non-interventional glucose sensing, but these are only ongoing clinical trials. As of now, the latest will be the Libre 3. So I have shown you the Libre Pro, and then Libre is available, which is a real-time device which will be launched in India in a month. So by November, Libre will be available in India. So it will be a reader or with your mobile phone. Mobile phone app will be available in India by the end of February next year. And that will provide you with the real-time reading every time. And then Libre 3 has also come. As of now, that is a story with blood glucose monitoring, including an implantable sensor which can be put underneath the skin and will automatically provide the information every 5 minutes to your mobile phone. And the same implantable sensor can be there for 6 months. As of now, TIAS, it is only undergoing the clinical trials, not available in the open market. So thank you very much.
Thank you, sir, for that wonderful thought. I think there are questions coming up, but I think for the shortage of time, we will take up the questions at the end. We have the other lectures to come. Thank you once again, Joseph, sir, for your informative lecture. We will move on to the next lecture. Can you allow me to share the introductory slide?
Yes, sir.
So with this, I take you to the next speaker, who is none other than Dr. Rajesh Muralidharan, who is currently working as a senior consultant intervention cardiologist in the Department of Cardiology at Baby Memorial Hospital, Calicut. His areas of specialty include angiography, angioplasty, stenting, and peripheral vascular disease. He is also an expert in intra-aortic balloon counterpulsation, rotablator, and also an expert in intravascular ultrasound imaging, coronary flow wire, and pressure wire technologies, and visual histology. And he also takes into consideration the management of the congenital heart diseases with ASD and PDA closure, and also in valvular heart disease. He also has interest in invasive hemodynamic study for congenital and valvular heart disease and endovascular repair of aortic diseases. He has got many publications in reputed journals. He has got awards for original research work during his academic time and during his work. And he has done more than 20,000 angiographies and 5,000 angioplasties. So I hand over the session to you, dear Dr. Rajesh, sir, for your enlightening lecture. And he will be talking on angioplasty, when and how.
Thank you, Dr. Prashant. Am I audible?
Yes,
yes, sir.
Yes.
Yes, sir.
And the slide is visible?
Yes.
Yes, sir. Yes.
Thank you, dear Rotary Club, for this invitation. Thank you, Dr. Harish, who is a good friend, big brother. I call him Harish. So thank you for this opportunity. I'm Dr. Rajesh. I'm from Calicut. I work at Baby Memorial Hospital. And for the next 15 minutes or so, I'll be talking to you about angiography and angioplasty, what we should be knowing about. Because very often we find that I have undergone angiogram, angioplasty, my friend has undergone angiogram, angioplasty, and there is a lot of confusion and debate about what it is and what should have been done, what can be done, and all those things. Now, since we are running well behind schedule, I would encourage the host to interrupt me to any time he feels like. Harish wanted me to actually present a lot of things. I'll stick to coronaries. He actually wanted to speak about ICDs, CRTs, and devices also. But in the interest of time, I was decided to stick on to the coronary arteries. Coronary arteries basically means the blood vessels to the heart. This is the artist's view of the heart and the blood vessels to the heart. As you can see here, there is one artery to the right, that is the blood vessel to the right. There is one to the left. the artery to the left divides into two. The one is called LAD, or left anti-descending artery, abbreviated as LAD, and one to the back that's called LCX, or the circumflex artery. So basically, when you're talking about the heart, you have a left main coronary artery. I'll use the pointer here. So you have the left main coronary artery, and then the LAD, that is left anti-descending artery, the left circumflex artery to the back, as well as to the coronary artery. Now, the coronary angiogram is a moving X-ray of the blood vessels to the heart. That's what is basically meant by an angiogram. The technology is basically an X-ray. As you all know, it is just a film that we get on an X-ray. But in an angiogram, it's a moving X-ray. Now, this is the frozen frame of that X-ray. As you can see in this cartoon, again, you have the right coronary artery, abbreviated usually as the RCA. And on the left side, you have the left main coronary artery, which is dividing into LAD and circumflex. And on the angiogram, you get a picture like this. This is how it is shot on X-ray after injecting a dye or a contrast, which we usually call as the contrast, which is iodine content under the and is visible under a moving X-ray, which is otherwise called a fluoroscopy. So angiogram is basically a fluoroscopic picture or a moving X-ray picture of the blood vessels to the heart. That's what the coronary angiogram means like. Now, why I should undergo a coronary angiogram? That's the first question that most people ask us. You need to undergo an angiogram if you are suffering an acute MI. That's a usual technical term for the word heart attack, acute MI. If you are having a high risk unstable angina, this is also a heart attack, say slightly of a different lower grade compared to the first one. If you are having a stable angina, like what Ajay was talking about, like when you walk, when you are getting symptoms, then you should probably undergo an angiogram. Especially if your symptoms are not controlled despite optimal treatment. High risk criteria on non-invasive, if you are doing a treadmill and you find that there are significant ECG changes, you should go through an angiogram. Patients who have been successfully resuscitated out of a sudden cardiac death prior to any surgery on the heart or the valves or on the blood vessels after 35, some say 40 years of age, and as a part of perioperative risk stratification in a select few. So these are the usual scenarios in which you will be asked to go through an angiogram. Now, the billion-dollar question that most of us ask is that people get confused, and they, with all this WhatsApp University giving all these rumors, I've heard that they overprescribe angiogram these days. Now, angiogram should not be done as a screening test. This is a very common question that we usually find in our OPD, that doctor, I thought that all Malayalis are there, but I have chest pain. Let us do an angiogram and find out whether there is a block. Now, it is not intended as a screening test for coronary artery disease in asymptomatic patients. Patients with non-specific chest pain, that is patients who do not fulfill the criteria what Ajay sir was talking about, should not go through an angiogram. After bypass surgery and angioplasty, many of you would have undergone an angiogram or a angioplasty or a bypass surgery, but a routine angiogram to see whether those things that what people have done to your heart is still flowing is not indicated. People who have received thrombolytic therapy for MI and have no symptoms of ischemia, that's a technical thing. I will not go into the details, but routinely angiogram should be done only for those patients who are at higher risk. Now, what are we looking for in an angiogram? See, this is a postmortem cast of the coronary tree or the blood vessels to the heart. In an angiogram, you are seeing only the larger blood vessels to the heart. The black ones are the larger blood vessels to the heart, as you can see here. From those larger blood vessels, you see small blood vessels which are called capillaries that go into the muscles and give the blood that cannot be seen with the angiogram. But that is unimportant because those blocks in those vessels or small vessels are inconsequential. So what we are trying to do and see in an angiogram is those blocks in those larger arteries to the heart. Now, what does a block look like? This is the angiogram of the right coronary artery or the RCA, and if you can see where the arrow is, you can see that it is almost cut off here. See the dimension here and the dimension here and the dimension here. You can see that it's considerably less wide here compared to the other areas. So that means that through this point, the dye is not flowing enough, and that is the region of a block. So this is how a block would look like on a coronary angiogram. Now, how do you do a coronary angiogram? That's a question that people will ask you. Over the next few slides, I'll show you a recorded video of how an angiogram is being done. Now, you should imagine this heart as a tank and the pipe as your blood vessels or the arteries inside the body. The tank is connected to the pipes. So you breach into any of the pipe, you can ultimately get into the tank. Similarly, you can go either through the artery of the right hand or through the groin and then reach the tank, that is the heart. Now, this is how it is done. This is actually a patient who has undergone an angiogram through the right side, that is the right radial side from the wrist. And this is the fluoroscopic picture or the X-ray picture of a person who has undergone an angiogram from his groin. As you can see, this is the femoral head or the hip bone, and it is through this artery that you are going to pass all your tubes and wires and all those things to reach the heart. So it's just like a tank and the pipe system. You breach into the pipe system, you can reach the tank. Consider the tank as the heart, and you can reach there. That's how you need to think about it. Now, this is the picture of how an angiogram is being done. You can see the catheter being thread into the heart over a wire which is first passed. Yeah, this is the radial picture. You can see the wire going on. These are the two bones of the forearm. The wire is first passed across that. You can see the wire being taken in. This wire is going up, up. And at this point, this is the collarbone. You can see a tube that is coming over and above that. This wire is being put across, and the tube is following the wire. And you are now, this is the heart. You can see that moving heart. So that's how that tube is threaded into the heart across during a radial artery angiogram. Now, this is how that tube would look. This is how the angiogram would look like once you have manipulated into the coronary arteries and you're injecting the dye. This is the angiogram of the left side of the heart, and this is the angiogram of the right side of the heart. That motion, that movement that you see is that of the heart, and the larger blood vessels or the larger blood vessels that supply the heart are as is shown. This is a normal angiogram of a patient. This was actually done around 9 years back, and this patient is still fine. Now, the next question is, if I am found to have block, what next? It depends on the degree of block, the number of blood vessels affected, technical factors, and patient wishes, as well as the economic burden. Now, there is no single answer to it. People often get confused that I was told angioplasty, why did they do bypass? Vice versa. So it's not about whether you have to do an angioplasty or a bypass, but it is about the extent of the disease and the type of the block. Now, what you must understand here is that all blocks need not require angioplasty or a bypass surgery. Only those blocks which are more than 70% are considered to be obstructive and limiting the blood flow. As in this point here, it's only around 30-40% or maybe at the max 50% compared to the normal segment here, and it doesn't require a treatment. Consider this point, it's quite narrow compared to the normal segment here. So this is probably around 90% tight, and this one requires to be tackled. Now, how to be tackled, that depends on the extent of the disease as well as the technical factors. Now, it's not about angioplasty or a bypass, but it is about taking a decision that best suits for the patient. The angioplasty may be the best option for you, bypass option may be the best option for me, and it may be medical treatment for somebody else, but that you need to take into all these things. So just not get carried away by the easiness of or the less cumbersome thing of angioplasty, but it's about taking the right decision for the patient. Okay, now it's not that it's a general misconception that when you have 3-vessel disease, you should go through a bypass surgery, and when you have only a single-vessel disease, that is only one of the blood vessels that is affected, you should go through a angioplasty. Now, that's not the case. The technology has advanced further. Even people with 3-vessel disease are treated with angioplasty, and sometimes even patients with a single-vessel disease may have to go through a bypass surgery. So it is about getting the right thing for the particular individual, which also depends on the clinical acumen. I'll show you this angiogram of this particular gentleman who actually ran out of his office because of chest pain, took his car, and then dashed into our casualty. The stretcher that is kept outside of the stretcher, he just got into that, then had a cardiac arrest. 45 shocks he received. He underwent angioplasty, and while the cardiopulmonary bypass cardiopulmonary resuscitation was going on, this happened in September 30th of 2011, as you can see, and he is now back to work. So life-saving procedure in a MI, of course, is going to be an angiogram. You will not be able to do a bypass surgery for this patient, and you need to take an individual decision in this patient. So like what Dr. Ajay was talking about, it's about reaching safe. Luckily for this gentleman, he although took a risk. He should not have never done that because he drove through the Mau Road of Calicut. And you know how busy it is at night around 9 o'clock in the morning. That Mau Road of Calicut in his own vehicle reached our casualty. And then he was fortunate enough to get onto the stretcher himself. I used to tell him that, you know, you're just like that Jagati in that Minara movie where he's telling, where is the stretcher? I used to quip him even at 9 years and after 9 years. Now this is how an angioplasty is being done. Yeah. Suppose this is a block in the artery. This is a narrow coronary artery. You have to first get into the system through a catheter. This is from the groin. And as you can see in this cartoon, you have first the tube going in. First, then you have the wire that is going across the block. That's the animation to that. And then you have the stent and the balloon. Just watch onto this point. You can see the stent and the balloon reaching that point. This can be inflated. This is a balloon that is there. It can be inflated. You can see the stent over that. And that is getting inflated from outside. You can do it from the groin. There is a device called indeflator that can be, the balloon can be deflated and you can pull out the wire as well as the balloon. The stent becomes part of the body over time as tissue grows over the sides. So that's how the angioplasty will be done. Now there are different things that we do. This is how a stent would look like. This is how the catheters would look like, and this is how the balloon would look like. There are two different types of stents, bare metal stent and drug-eluting stents. I'll not go into the details for want of time, but just mention that the drug-eluting stent and bare metal stent would look alike if you were to see live. Only thing is that the drug-eluting stent will have a polymer and a drug that is loaded on that is covered onto the stent strut, so that there is less chance of a reblock inside the stent. But the reblocks do happen, and that can maximally happen in the first 6 months to 1 year, although it can happen late also. So you need to be very pakka with your medicines if you are going ahead. Now bypass grafts also do appear blocked. This is an angiogram of a patient who has had a bypass surgery. Generally the arteries from the neck are actually well perfused. They actually have 94% patency at 10 years, whereas the saphenous vein grafts 50% are blocked at 10 years. Now let me just introduce you to the newer technologies in coronary angiogram. Now this patient was referred to bypass surgery while I was a resident in Sri around 10 years back. Now he has a block where the blue arrow is compared to the narrow point. Okay. So this patient was referred for a bypass surgery, but the problem here is that people were not convinced that that point was right. And just like you and me will have a difference of opinion. So in this comes the scenario of an intravascular ultrasound, where you can put the ultrasound probe into the coronary artery and see what is happening inside of the coronary artery. This is called IVUS. Now it's just your miniaturized probe that just ones like that you use for scanning the lumen, and you can get a picture like that so that you can see what the true lumen is. This is how the inside of the coronary arteries would look like. And when it was put into this patient, it was found that it is quite white and patent, unlike what you see from outside, because you get a two-dimensional picture of a three-dimensional structure in an angiogram. And you can see what kind of block it is. You can see the red, green, and all, fibrous, fatty, and all these things. There are a lot of names. And this patient was found to have a big block, a big lumen, and not an obstructive disease. And this patient, who was referred for bypass surgery, was kept on just medicines after IVUS assessment, and he's still fine at 12 years after he was offered bypass surgery earlier. So the technology has moved forward from angiogram to IVUS and the further technologies that I'll be referring to earlier, where you can have further assessment or refinement of your assessment of blocks. I'll tell you the other part of the story now. This is 46-year-old lady, our own hospital PRO. She's dyslipidemia. She has typical symptoms, and her treadmill was positive. So we took her for an angiogram, and this was the angiogram of her. People were actually searching for a block here. We couldn't identify one, although she had typical symptoms. This is how the left system would look like. This is how the left system would look like. As you can see here, there is a suspicious area here, but it's probably 30-40% and not the 70% criteria. But she still had typical symptoms. So we brought in something called a pressure wire, where we measured pressures across the stenosis, and then we found that this pressure is less than the ratio of the pressure on either side is less than 0.8. That's something this technology called FFR, or fractional flow reserve, told us that this is the block, and then she received a stent to that position, and now she is fine at 1.5 years of follow-up. So You can have the other way around also, where angiogram shows that you don't have much of a block, but you do an FFR and then find that there is a block and you can stent and help the patient. Now, the last part is something called optical coherence tomography. This is much like OCT. This is the OCT of a patient who had received a stent. You can see the angiogram going around here. This is the OCT, or the optical coherence tomography. Pull back. You can see those spokes sort of thing, which is the stent areas. And you can see that it's a widely patent lumen. So you can have the assessment of the coronaries. This is how your coronaries would look like if you were to look at it from inside. So in conclusion, coronary angiogram is a luminogram. Judicious and appropriate selection between angioplasty and surgery should be made for an individual. It's not that a one-size-fits-all. Drug-eluting stents offer considerable advantage over bare metal stents in terms of restenosis, but the risk of stent thrombosis must be noted. Continuation of medical therapy is extremely essential. And as Dr. Jyoti Dev told, control of risk factors must be emphasized to prevent progression of disease in other places as well. Thank you for your time and patient listening, and I'll be happy to take a few questions.
Thank you, Dr. Rajesh Muralidharan, for that very useful and informative talk about angioplasty and angiogram. Thank you very much.
Thank you, sir.
Over to moderator.
Thank you, Dr. Rajesh, for that wonderful exposition of coronary angiography. We have a few questions. I think we will take up the questions after Dr. Narasimhan's lecture. Without much of introduction, I will just move into the next speaker, who is none other than Dr. S.M. Narasimhan. I am very much privileged and honored to introduce him to this audience. Dr. S.M. Narasimhan is the Vice Chairman of the Lipid Association of India, and he is also the Adjunct Professor of the Tamil Nadu Medical University. He is also the Managing Director of SMN Diagnostic Center and SMN Specialties Clinic in Chennai. He is also the Dean of Professor M. Vishwanathan Diabetes Research Center and MD Hospital for Diabetes in Chennai. He has published numerous articles in prestigious medical journals and contributed chapters for textbooks of medicine and lipid disorders. I have been very fortunate to hear many of his lectures during my postgraduate days at Stanley Medical College, where he used to have regular lectures on hypertension and internal topics in internal medicine. He has given more than 350 guest lectures at national and international conferences. He is also the Vice Chairman, of Lipid Association of India. He has published expert consensus statements, recommendations for lipid management, the management of cholesterol in India with respect to the Indian scenario. He has also received many awards, Lifetime Achievement Award by the Tamil Nadu Dr. India Medical University. He is a Master Teacher Award by the Indian College of Physicians and Association of Physicians of India. He is a Distinguished Teacher Award. He has got Distinguished Teacher Award by the Government Stanley Medical College and Hospital, and also the Jivraj Mehta Award by the API and Indian College of Physicians, one of the 5 selected across the country. So I hand over this session to you, Narasimhan sir, for your lecture.
My slides are visible?
Yes, sir. Yes, sir.
Thank you very much, Dr. Prashant. At the outset, I would like to thank Dr. Harish for giving me this opportunity to get associated with the Rotarians of Kerala. And I am the last speaker because we have already crossed the time. I would like to probably present some important messages how to prevent heart attack. I think many of the previous speakers were talking medically, and they were all useful mainly for doctors and not for non-medical people. And I was given to understand by Dr. Harish that most of them will be non-medical. Why not to talk at that level? I thought I can probably briefly inform you about the presentation. This is the heart, which is situated in the center of your body. You can just see the four-chambered center of your chest to receive the blood from the body, to pump it to the lungs, to receive oxygen from the lungs, to send it back to the body. Very simple. Heart beats 60 to 100 beats per minute, about 1,15,000 times every day. Pumping heart is controlled by tiny electrical current. The heart muscle also requires oxygen and nutrients to work properly. It is usually supplied by the coronary arteries. This picture was shown to you by the previous speaker. This is actually the arteries which are actually seen with so much of fatty substance in it. This is called atherosclerosis. We know that atherosclerosis is a preventable disorder. What is atherosclerosis? Athero means fat. Sclerosis means hardening. So fat has already accumulated in the blood vessel and it has hardened. It can manifest as number 1, angina. Number 2, unstable angina. Number 3, myocardial infarction. This is the fatty streak. FS is a fatty streak which is seen in the cut section of the artery. And this will probably be seen even in the first decade of life. Even in children also it can be seen. 30 to 50% of the intimal surface, actually the big aorta, is actually occupied by the time somebody reaches 30 years of age. But specifically in coronary arteries, only in predisposed individuals, for example, somebody is a diabetic, somebody is having high blood pressure, somebody is having a family history of coronary artery disease or death in the family prematurely. Such people are likely to accumulate more amount of so-called fat deposits, which may probably evolve into plaques, and the plaques may rupture, may land in problems like acute myocardial infarction. What is angina pectoris? Angina means pain. Pectoris means chest. In simple terms, I'll call this as angina. It may manifest as 1, chest pain, pressure in the chest, squeezing, burning, heaviness, tightness. Often described by many people as indigestion. They try to swallow gelusil frequently. The site of the chest pain is most important, and the radiation of pain can go to the left shoulder or to the back or to the lower portion of the jaw. Sometimes it is associated with the sweating, nausea, vomiting, sometimes shortness of breath. Any one or the combination should alert you to seek medical advice. Angina, it is triggered by activities that can increase the heart's oxygen demand. For example, somebody is lifting a heavy weight, probably may get an angina. Exercise, large meals. People used to die after taking a heavy meal or heavy biryani, this, that. And the cold or hot weather can predispose these people to get into problems with angina. Post-sexual activities probably can also be a problem those people with angina. The type and severity of angina varies from person to person. Decreasing the harsh need for oxygen by taking rest, or your doctor would have prescribed some nitroglycerin tablets, and you keep it under the tongue, it relieves the pain, you are happy. The next day you don't see the doctor. Such postponement should not be there. You need to see the doctor if the angina repeatedly occurs and troubles you a lot. Angina does not cause permanent muscle damage. Please remember that it does not cause permanent muscle damage. Now I'll take you to the other important part is the myocardial infarction. When a narrowed artery is completely blocked, the blood flow is stopped. The heart muscle beyond the blocked artery actually gets permanently damaged due to lack of oxygen. This damage of the heart muscle is now called as myocardial infarction or heart attack. The symptoms almost same, but it is prolonged. Sudden, severe, crushing chest pain. The person would not have experienced pain in the chest earlier in this way. Doctor, I am got very severe, intolerable pain on the left side of the chest. It looks as though some heavy weight has been kept on my chest. I cannot breathe properly. I have some palpitation. I don't know whether this is my last day. Somebody comes and tells you like that. I think the doctor should be aware of all the symptoms, and the people around him should know that he is getting into heart attack. Nausea, vomiting, weakness, shortness of breath, bluish, ashen looking skin, sweating and cold, clammy feeling skin, urge to have a bowel movement. I had seen people visiting the bathroom and they don't come out of the bathroom at all. We used to go there and declare death also. It had happened for my own patient. Feeling of impending doom. So he knows that he's going to collapse. So that is myocardial infarction. If you experience any of the symptoms, it's very, very important to inform your doctor. Go to the nearest emergency medical facility for further evaluation. Don't think that so and so is available in Chur. I will go and see him next day morning. I will postpone my consultation. Don't take any sort of risk like that. Try to see the doctor as early as possible. Do not wait for the symptoms to go away. Okay, it's all right. Let me take some hot water. Let me take some water. Let me take some antacid tablets, or the Gelusil will help me. I have seen patients who had swallowed Gelusil 3 nights completely, on the 4th day, and he came, he died, and I was examining him. So that was a problem with the myocardial infarction. Patients had been postponing sort of consultation. So many times the damage to the heart muscle can be minimized, and treatment, if your medical attention is in the first 1 hour mainly, or in the first 3 hours after the onset of symptoms. And we call this as a golden hour. Somebody seeks advice within 1 hour, you can do wonders. Or if the person postpones it and reaches the hospital within a matter of 3 hours, you can probably still do good things for him. This has already been highlighted. You go to the doctor immediately, he takes an ECG and identifies where exactly is the problem, which part of the area of the muscle which is affected. I don't want to dwell there. We'll need to talk about the risk factors of heart attack. That is more important for non-medical people. The risk factors are conveniently divided into two. One is non-modifiable, other one is a modifiable. Nobody can probably change your age. Again, we cannot change our sex. The family history of heart attack is very, very important. I have about 6 or 7 families who have been getting these problems of heart attack. Grandfather died, father had undergone bypass, the brother had undergone stenting, and the fellow, actually, the person who was entering into my clinic, was hardly 26 years old. I asked him, what's the problem? I have come from United States. My father brought me here saying that you are the cholesterol specialist, I was told. I thought I should seek advice from you. What is your cholesterol level? It is 200, doctor. Then I asked his father, when did you undergo bypass? Sir, how do you know that? I know that you have also got it. Now, come on, tell me the story of your family. He started coming out with a lot of details, lots and lots of details that all his family members were affected because of the cholesterol problems. So we need to remember that the family history of premature coronary artery disease before the age of 55 in a male, before the age of 60 in a female, somebody is dying due to heart attack, it indicates that there is a family problem. I think we need to probably screen the family members to isolate this sort of entity and need to treat them appropriately. What are the modifiable risk factors? Smoking is the most important problem that one has to emphasize and re-emphasize repeatedly to our patients not to smoke. Very important. Smoking causes, and is the #1 risk factor leading to heart disease. Heavy smokers are twice the risk of non-smokers. There are about 4,000 substances that have been identified in the cigarette smoking. Nicotine and carbon monoxide damages the smooth inner lining of the arteries. Blood cholesterol. I think many of us had been probably indulging in this sort of excess food intake, dense calorie foods like your pizza or burgers, all those. Even our children liked it, and they continue to enjoy this sort of food. Of course, now this pandemic period, I think many of them are not going out. I need to simplify the cholesterol problems into 3 categories. #1, good cholesterol. What is good cholesterol? HDL. Bad cholesterol, LDL cholesterol. What is ugly cholesterol? It is ugly because it is connected to so many other factors. So it is triglyceride cholesterol. Now look at this artery where the HDL cholesterol is a good cholesterol. This actually takes the fat material, takes it back to the liver. It doesn't allow the fat substances to stay in the vessel wall. Whereas I look at the LDL cholesterol actually puts the fat here, says, oh, no, stay here, I will take care of you. So the LDL comes and deposits all the fat substances inside the coronary arteries and leads to problems. You must know the numbers, because everybody should know the number. Nowadays, everybody is actually, they try to visit the Google doctor first before they go to the doctor or their own family doctor. They try to Google everything. And you must know the numbers also. Triglyceride, if it is more than 150, abnormal. Total cholesterol should be less than 200. HDL should be less than more than 40 in a male, and it should be more than 50 in a female. And LDL cholesterol should be less than 100 in patients without heart disease. In patients with heart disease, it should be less than 70. We call it as a non-HDL cholesterol. I don't want to say what is non-HDL cholesterol and all, because it's too much for a non-medical man. I don't want to dwell. Non-HDL cholesterol is 30 milligram more than that of the LDL cholesterol, and that value also should be probably kept at the goal. Now we categorize patients into risk, very high risk group. We try to keep the levels as low as possible. Lower the LDL, that is better. Earlier the better treatment, and the longest duration of treatment with the statin drugs are the best, wonderful drugs. They are safe, they're efficacious. It has controlled many problems. It has saved millions and millions of lives throughout the globe. Please remember that. Our association called Lipid Association of India has gone to an aggressive step now, talking about lowering of the LDL cholesterol to the levels less than 30 milligram. Why this 30 milligram? We were all born only with a 30 milligram of LDL cholesterol. We are now trying to reach that particular goal to get rid of this menace of cardiac disease, particularly heart attacks. The next problem is a physical inactivity, a sedentary lifestyle, more common, 2 times more common. When will you call this physical inactivity? A person who is not able to maintain 150 minutes of exercise per week. 30 minutes per day for 5 days a week, 2 days you can take off, but not Saturday, Sunday. It can be Wednesday and Sunday, not Saturday, Sunday, not 2 days together. Physical inactivity, if somebody is not able to make 150 minutes of walking particular week, that means he has become physically inactive. Please remember that. Diabetes, I think it is a big epidemic in our country, and we need to identify people with diabetes, pre-diabetes. Before the development of diabetes, there is a syndrome called syndrome X or insulin resistance, which need to be addressed by all our people. We would have seen many people, very obese people with a big tummy, and those are the people who have multiple problems, not only diabetes, hypertension, cholesterol problems, heart attack problems, and such problems are now rampant in our country. We need to address such issues. High blood pressure, again, this is a very important because silent killer. Normally, it doesn't produce any symptom till the patient gets into problems of heart attack or heart failure, or a stroke, or a dementia, or a kidney failure. Till that time, patient may not be aware that he is become a hypertensive individual. 5 times risk of getting heart attack. Very important information. What I thought I should share. Obesity, again, repeatedly we have been specifically giving importance to this BMI, body mass index. Weight in kilograms divided by height in meters square is called body mass index. If you are able to maintain it below 23 is fine. Above 23, now we call it as obesity. Abdominal adiposity. If you have a measuring tape just to measure your waist circumference, as though the tailor is making the measurement for your pant size. Nowadays, we don't go to the tailor because we go and buy only the ready-made shirts, ready-made pants. But if you go to the tailor, probably you'll be taking the measurement. If you are allowing your tailor to take the measurement, what the measurement tape or the measuring tape, what the fellow is using, if you have it on your table, doctors, or if you are having it at home, try to measure your waist circumference. If it is more than 90, you should be very careful if you're a male. If it is more than 80, if you're a female, you should be very careful because that is the one which is the triggering factor for heart attack. Please remember that. Childhood obesity is much commonly seen nowadays in our country, which need to be addressed repeatedly. So we need to probably educate these children with the help of school teachers at the level of school or at the college. Personality. You and I probably will not behave in the same way. Type A person, type B person, type H. Type A is a person who is actually very, very aggressive personality. Whereas type H is a hostile personality in association with the type A, which I don't want to dwell. So it all depends on the person's attitude towards any problem. It's not a single factor that is operating in an individual. Please remember there are multiple factors that are responsible for heart attack. This was highlighted by the previous speaker, how angiograms are being done. I don't want to dwell here. Prevention of heart attack, please, if any one of you who is listening to this particular lecture, if you are a smoker, please, if you are going to give me some sort of appreciation for my lecture or something, what I can request you, stop smoking from this night. If you are able to do that, I'll be too happy. Please. Smoking cessation will help you a lot. Within 2 weeks, the RBCs actually are free of carbon monoxide. Within 2 years, your disease risk comes down. Within 10 years, chances of dying because of heart attack only slightly more than that of a non-smoker. Increase physical activity, 30 minutes of daily walking per day for a period of 150 minutes per week, sufficient. Resistance exercise should also be combined. 15 minutes of resistance exercise if it is done 3 times a week, I think it is sufficient. Walk for life. The more you weigh, the more sooner you die. Please remember, the more you weigh, the sooner you die. Diet is very important. I think the saturated fat should be cut down. It should be not more than 7%. MUFA should be increased. MUFA should be 10%, which I don't want to dwell here. Suppose somebody asks a question, I will be in a position to answer. Complex carbohydrates should be 50 to 60%. Soluble fibers should be taken in plenty. Protein should be around 15%. And healthy heart diet. Eat a variety of food, very important. Eat in moderation. Restrict the total intake. Minimize the saturated fat intake. Avoid hydrogenated fat. Reduce cholesterol intake. Limit alcohol intake. Take adequate fiber. Restrict the simple sugar. And limit the caffeine intake. Sugar and salt needs to be avoided as much as possible. Weight loss, you need to aim for a weight loss, very important. Have a blood pressure checked at a regular basis. These are all the modifiable risk factors which I was mentioning. Cigarette smoking, diabetes, physical inactivity, atherogenic diet, burger, pizzas, high dense calorie foods, weight, obesity, hypertension, are all these factors which will push you for heart attack. Try to control all these factors, then you will live for a longer period. Is there a role for yoga, meditation? Yes, of course. Even if you still continue to get some sort of anxiety, depression, just because the neighbor died due to heart attack, try to see a psychiatrist also, because your anxiety will not be relieved by your doctor also sometimes. Treatment, listen to the doctor. Don't think that you are the best person to decide whatever is the problem that you have. The doctor is the best friend of yours. Try to give him this respect, due respect, because he's a knowledgeable man who is in this field. He will probably direct you in such a way that you will become better. Yes. Ladies and gentlemen, having talked this much, I thought I should tell you what Bhagavad Gita told us thousands and thousands of years ago. One who observes control over his diet, one who takes regular exercise, one who has time to relax, one who has a right toil to discharge of his duties, one who observes proper hours of sleep and awakening, and one who is balanced in actions and reactions, emotions, peace, duties, and rewards, conquers disease. Thousands and thousands of years ago, Krishna told this. Still, we are practicing the same thing to avoid heart attack. Thank you very much, ladies and gentlemen, for patient listening.
Thank you. Thank you very much, Dr. Narasinghan, for that for sharing us about the risk factors of heart attack in a very simple way. Thank you very much. Over.
Thank you, Narasinghan sir, for that wonderful lecture. The last slide actually put a good end to this meeting. That was the perfect slide to be put at the end of the meeting.
So nice. Thank you very much.
On prevention, and it's all about a healthy lifestyle and prevention of cardiovascular disease. There are a couple of questions. I think Narasinghan sir can take up these questions, especially on lipids, your area of interest. So there is one question by Dr. George Moulail who has asked, by Dr. Pradeep actually, who has asked, what are the effective methods to improve the HDL level?
See, HDL is a high density lipoprotein cholesterol. In fact, now we consider this as an indicator, a risk marker. And it is probably added to assess the risk to identify who is at a moderate risk, low risk, or a high risk, or a very high risk. We don't consider HDL cholesterol now as a target to get treated. Best way of increasing HDL cholesterol is only by exercise. You need to do vigorous exercise only, then HDL cholesterol will go up. Any method of improving HDL cholesterol by giving some drugs and increasing it, all the drugs have failed to show any sort of benefit in reducing the cardiovascular outcome. So we don't advocate any pharmacotherapy or drugs to increase the levels of HDL cholesterol in anticipation of reduction of cardiovascular morbidity and mortality.
Sir, there is another question which is closely related to that, the role of using oil high in content of monounsaturated fatty acids.
When the question of oil comes, you need to have a balance between MUFA and PUFA. So if you have the groundnut oil, nearly 52% of MUFA and 42% of PUFA. It's a good combination. So if you have a groundnut oil, that is probably solves the issue. The next best oil will be your the olive oil, mustard oil, rice bran oil, all these oils are good.
And I should specifically ask a question from Kerala. It should be, there is a question about coconut oil, which is highly debated there.
Yeah, I know that you would be asking a particular question with respect to coconut oil. Coconut oil contains lauric acid. Lauric acid is a saturated fat. In fact, trials which were conducted in one part of the United States have not shown any beneficial effects by advising people to take coconut oil in their food. In fact, the incidence of coronary artery disease was on the rise in those segment of people who had consumed coconut oil for several years. So that is a study which had been published. And I think if you are going to have a balance of this oil plus olive oil or groundnut oil or a mixture of oils, I think probably that will solve the issue.
Thank you, sir. Those are all the questions that I can see in the chat box. If there are any other questions which the members would like to ask, I request them to unmute and ask the question.
If they are common questions, you can ask that question.
All the
And
other panelists are also available. Dr. Rajesh is also available, as is Dr. Ajay Kumar.
You can use the hand raising tool as well, because you may not be able to unmute yourself because
okay, yeah.
You can use a chat box, and you can use a hand raising tool. I can unmute you. Otherwise, it may not be possible. Or else you can use a chat box for further questions.
Okay.
Dr. Prashant, I'm not seeing any hand raising at all. Only questions are coming.
I think it is 10:15. So
yeah, we are.
I think. I think we will wind up the session. There is another question which is there. This is to Dr. Rajesh Muralidharan. Dr. Rajesh, how about the prospect of new drugs known as Prodiscoming? To my knowledge, it is something related to the shark oil and something like that.
I'm not sure about that.
I think this is something related to the shark oil, and there were some trials done in the past, similar to what we have with the EPA DSA. But I think there is no big evidence with Prodiscoming to show that it is beneficial. We had a lot of studies about 10 years ago to show that it was a promising drug, but right now we don't have any strong evidence to suggest it as a good treatment. There are studies which are going on.
Thank you, Dr. Prashant. We have already exceeded our time limit now. It's already, so we'll end the discussion.
Okay.
I think we'll go to the.
Thank you, all the panelists, all the doctors, Dr. Ajay Kumar, Dr. Narasimhan sir, Dr. Rajesh Muralidharan, and Dr. Jyotidev sir for enlightening us with this on this hard day, World Heart Day, with their topics. I think all the members who have joined in have benefited by this lecture. Even I myself have benefited. There are a lot of new things which we hear and which we can carry on, which we can forward to our own patients. And I also thank the Rotary Club for giving me this opportunity. I hand over the session to Dr. Harish. Harish sir, can you?
Yeah, thank you, Prashant, for a nice presentation. And I feel everything went on well. And actually, we had on different some not only for a simple topics, but also some newer methodology also is included, so that people should know that there are recent methodologies. And Dr. Rajesh, hello, Dr. Rajesh?
Yeah, I'm hearing you.
Okay. Yeah. Even for if there are patients with 3 vessel, patient is still doing 3 vessel angioplasty.
Yeah, it's possible. It's possible.
Yeah, it's possible. So many patients having one question came in between asking.
Yeah,
Okay.
it's possible.
Okay. So in that way, even Dr. Ajay Kumar, how to recognize, and Dr. Joseph, how is the diabetes connected with heart, and also for the procedures, Dr. Rajesh has done a very nice presentation. So that I don't think everything is explainable. And also, Narasimhan, as always, I feel like a guru. I have seen him from my times. I used to attend all these CMEs and at Chennai. From that time, we have a 5-day MB hospital. That time we used to have a workshop. So sir used to come and take classes. That is around 15 years back. From that time, I'm very much associated, and he has not only declined any. He has come every time from Chennai to Pala also, and he has presented. And all our speakers have done very well. And even Dr. Ajay is my cousin also. So everyone has done a very wonderful job. I think whoever come was benefited a lot, because at a World Heart Day, it is nice to have all the pioneers in this field, and I thank them extensively for valuable time and spending and updating the knowledge to all our Rotarians. And thank you.
Thank you, Harish.
So what of?
you.
Yes.
Yeah, excellent presentations. I profusely congratulate moderator Dr. Prashant Shankar and all the faculties presented well and in a simple way. So there was no need of any questions even. So thank you all once again, and also for organizing this seminar. I congratulate Dr. Harish Kumar and also all the organizing team. And now I invite our Dr. George F. Mulel, District Secretary General, to propose the vote of thanks.
I'm sure that by the response, we have seen that all of you are benefited by this seminar. So I wish to thank our District Governor, Dr. Vavanikunnel, for arranging such a wonderful meeting. Dr. Ajay Kumar, I know him very well, and he is really interested in this topic. He is the zonal coordinator, and I wish to thank Dr. Ajay Kumar, our district trainer, PDG Muralidharan, Vice Governor, PDG Dr. John Daniel, PDGs Dr. KP Ramachandran Nair, then Dr. PDG Raghu, PDG Skaria, PDG Dr. G.A. George, PDG Suresh Matthew. Our thanks to Dr. Harish Kumar for organizing such a wonderful seminar, which was quite beneficial. Thanks to moderator Dr. Prashant Shankar and the speakers Dr. Ajay Kumar, Dr. Jyoti Dev, Kesdev, Dr. Rajesh Muralidharan, Dr. S. Narsinghan. All of you have enlightened us very well, because even a lay person could understand it very well. I wish to thank all the district officials, assistant governors, presidents and secretaries who participated in this meeting and made it a success. And finally, our thanks to our IT officer, Rotary Jojo, and ably supported by our AG Brijesh. They are doing a wonderful job as the conducting so much of virtual meetings. In fact, they are the backbone of the virtual meetings. I'm sure all of you will agree with me when I say that. Thank you all once and all, and very good night to all of you.
Thank you. Thank you, Dr. George.
Before I stop, I'll especially thank Dr. our IT officer Jojo for constantly helping me in his busy time, and all my flyer works and all the posters and things and everything is done by Jojo. And special because even in his he has attended so many meetings. In between, he has find time until 12 o'clock. He has woke up and done these things. So thank you profusely, because we are in busy schedule. We all he has to do everything, and he has sent it within 5. He is tell only thing 5 minutes. I'll send it. So he is very polite enough, and he has helped me in conducting this program in a very meticulous way. Thank you, Jojo. Okay.
Thank you, Harish.
We can't even imagine without Jojo and Brijesh what we would have done. Without Jojo and Brijesh, what we would have done this year.
Nothing else, Doctor. These all are opportunities, and I've taken the opportunity. Thank you, DG, for trusting me and putting me into the job. Thank you. Thank you.
Okay, Jojo. Thank you. And
you have gone into the job.
Adjourn the meeting. Adjourn the meeting. You can have further discussions. No issue.
So your microphone will be unmuted. You can have a further discussions on the way. I think
Yeah.
Dr. Tina is there from the beginning. Tina,
Yeah, Dr. T.
Tina
Yeah.
may be asking questions.
Yeah.
Now you unmute, Tina, unmute. You have to unmute, Tina.
You are muted.
I'm
Actually,
okay,
you
yeah.
unmute yourself.
Yeah.
Okay. Thank you. It was a wonderful.
So you have audio problems. You have audio
Got
problems.
a net connectivity problem.
All right. Next.
Okay, Jojo.
Yeah, we'll end the meeting.
Thank you.
Okay, thank you all. Good
Thank
night.
you. Very good.
Good night.
Very, very well.
Dr.
Very
G.S.
informative. Very informative. Very
Sir, good
useful.
evening, sir.
Dr.
Thank you.
G.S. George
Thank you.
was there from the beginning till the end.
From the
Thank you,
beginning
Dr.
till
G.S.
end.
George. Thank
Thank
you very
you.
much.
Good night,
And he
all.
was there from the beginning till end. Thank you, George, sir. Thank you very much.
Yeah, George sir. Thank you, sir. Thank you, sir. Yeah.
And Kenalji also. Kenalji also.
Yeah.
Thank you very much, sir.
George
Very
sir
nice.
is my DG.
Very
Yeah.
useful.
George sir
Very
is my
useful.
DG. Yeah. Yeah.
Very useful seminar. Very informative. Thank you very much,
Okay.
sir.
Yeah.
Very good.
Jojo, kindly send the video clipping. Okay. Okay.
Which one?
I think Harish.
Video.